Welcome back to Living Well After 50. Your body might be warning you about heart trouble without you even realizing it. Here are 11 unexpected signs you shouldn't ignore. And hey, don't forget to sign up for our free newsletter for more tips on living your best life after 50.
You know, we often think of a heart attack as this big dramatic event like in the movies, but really, our bodies often start dropping hints way before it gets to that point. It's more like a whisper than a shout.
Okay, I get that. So, what are some of the whispers we should be listening for?
Well, let's start with something that might surprise you. Your gums. If you notice bleeding gums or you've been dealing with gum disease, it's not just an oral health thing. Gum disease leads to inflammation. And that inflammation, well, it can spread.
Hold on, are you saying something as simple as gum disease could be a warning sign for heart trouble?
It's actually more common than you'd think. That inflammation from gum disease can actually let bacteria into your bloodstream. And from there, they can travel to your arteries. Yeah, and that can lead to plaque buildup, which restricts blood flow and increases your risk of heart disease and stroke.
So taking care of your gums isn't just about a pretty smile. It's about way more than that.
Exactly. Brushing, flossing, regular dental checkups, all super important. But it goes deeper than that. What you eat, how you manage stress, all of that plays a role in gum health too.
That's true. When I'm stressed, I'm definitely more likely to reach for the sweets.
Right. And maybe skip brushing your teeth now and then. So taking care of yourself overall, that's good for your heart in more ways than one.
Okay, so we've got to pay attention to our gums. Got it. What else? What other whispers should we be on the lookout for?
Let's move on to something a little more obvious, your legs. You experiencing any calf pain or swelling, especially after you've been active, that could be a sign of peripheral artery disease. PA, we call it.
Okay, I've heard of PA, but honestly, I don't really know much about it. What exactly is it?
It comes down to blood flow. With PAD, the arteries in your legs get narrowed or blocked, usually because of that same plaque buildup we were talking about with gum disease. And when those arteries are narrowed, your leg muscles aren't getting enough oxygen-rich blood.
And that's what causes the pain and swelling.
You got it.
So it's like a traffic jam in your arteries. The blood can't get where it needs to go.
That's perfect analogy. And here's the thing about PAD. It's not just about your legs. It often means you've got plaque buildup in other arteries throughout your body too, including the ones that supply your heart.
Oh, wow.
Yeah, PAD is a warning sign. Something's up with your cardiovascular system as a whole. And it's a warning we shouldn't ignore. If you're over 50 and having those symptoms, talk to your doctor. Early detection and treatment can make a huge difference.
Okay, so we've talked about our gums and our legs. Now, what about sleep? Could our sleep habits be giving us clues about our heart health?
Absolutely. You snore a lot. Especially if your snoring involves those pauses in breathing. Could be sleep apnea.
I know a lot of people who snore, myself included sometimes. Is it really that big of a deal?
Well, it can be. Especially when it comes to your heart. Every time you stop breathing during sleep, your oxygen levels drop, and your heart has to work harder to make up for it. It's like a mini stress test for your heart, over and over throughout the night.
Oh, wow. I can't imagine that's good for you.
You're right, it's not. Over time, all that extra strain can lead to high blood pressure, irregular heartbeats, and even increase your risk of heart attack and stroke.
So it's not just about getting a good night's sleep, it's about protecting our hearts as we get older. So what should someone do if they think they might have sleep apnea?
First things first, talk to your doctor. They can do an evaluation, recommend some treatment options. If weight's a factor, losing weight can help too. And just remember, taking steps to improve your sleep, it's an investment in your long-term health and well-being.
Makes sense. Okay, let's move on to another sign that might be a little more alarming. Sudden extreme weakness. We all have days where we feel tired, but when should we really be concerned?
Yeah, a little fatigue is normal, especially after a busy day. But we're talking about a sudden, intense weakness, seemingly out of nowhere, that makes even simple tasks feel impossible.
Like what?
Like trying to walk across the room but feeling like your legs are made of lead.
It does sound pretty terrifying.
It can be. That kind of sudden weakness can happen when your heart isn't pumping blood effectively, your body's not getting enough oxygen. It's a sign your heart needs help. Could be a warning sign of an impending heart attack, especially if you're having other symptoms too, like chest discomfort or shortness of breath.
So if you experience that kind of sudden weakness, that's definitely a sign to call your doctor right away.
Absolutely.
Okay, what about things that are a little less physically noticeable? Could our skin be trying to tell us something about our heart health?
Believe it or not, yes. Chronic skin conditions like psoriasis and eczema, They're linked to inflammation throughout the body. And remember, inflammation is a key player in heart disease.
So it's not that psoriasis or eczema directly cause heart problems, but they could be a sign of that underlying inflammation that's also affecting our cardiovascular system.
Exactly. It's all connected. So if you're dealing with a chronic skin condition that's not responding to treatment, it might be worth talking to both a dermatologist and a cardiologist.
Interesting. So our skin can be a window into our overall health, including our heart. All right, let's talk about another common experience, nausea or indigestion.
Yep.
We've all had an upset stomach every now and then, but when should we be worried it might be something more, especially as we get older?
You're right. A little indigestion after a big meal, usually nothing to worry about, but persistent nausea, bloating, or stomach pain that doesn't seem related to what you ate. That could be a sign your heart is struggling.
Really? How is our digestive system connected to our heart?
Well, think about it. Your heart's job is to pump blood throughout your body, and that includes your digestive system. If your heart isn't pumping well, it can affect how well your digestive system functions.
Ah, so it's like a domino effect. A struggling heart can lead to problems in other parts of our body too, including our gut.
Exactly. And this is especially important for women. Nausea and indigestion can actually be early signs of a heart attack for them.
Wow, I had no idea. So it's not always the classic chest pain we see in the movies.
Right. Women often have different heart attack symptoms than men, and that's why it's so important to pay attention to anything that feels off or different.
Good point.
If you're experiencing nausea along with dizziness, shortness of breath, or discomfort in your chest, jaw, or back, don't wait. Seek medical help immediately.
This is such valuable information, especially for our listeners who might be experiencing these symptoms and just brushing them off as just part of getting older. Speaking of things we might dismiss as we age, let's move on to number 7 on our list. A persistent cough or hoarseness.
Yeah, it's easy to just assume a cough is just a cold or allergies, especially during certain times of year. But if it's chronic, doesn't seem to go away, it could be your heart trying to tell you something.
Really? How can a cough be related to our hearts?
Well, when your heart's not pumping efficiently, fluid can build up in your lungs, and that fluid can trigger a persistent dry cough, often worse at night or when you're lying down. Could be a sign of congestive heart failure, which means your heart is struggling to circulate blood properly.
So if your cough is hanging around longer than usual, and especially if it's coming with other symptoms like shortness of breath or swelling in your legs, it's worth checking in with your doctor.
Definitely. Early detection is so important when it comes to heart issues. A persistent cough could be our body's way of saying, hey, pay attention to me.
That's a great way to put it. Now, this next sign is something we've probably all experienced at some point. Fainting spells? Or what doctors call syncope. Is this always something to be concerned about, or are there times when it's harmless?
Well, fainting happens when there's a sudden drop in blood flow to the brain, and it can have all sorts of causes. Sometimes it's harmless, like when you stand up too quickly and get lightheaded.
Right.
But if it's happening a lot, or during physical activity, or if it comes with other symptoms like chest pain or shortness of breath, it could be a warning sign from your heart.
So it's all about context. A single fainting spell might not be a big deal, but if it's happening often or with other concerning symptoms, it's worth getting checked out.
Exactly. Better safe than sorry when it comes to your heart health. Remember, you only get one heart, and it's worth taking care of.
Okay, let's talk about something that a lot of us might experience as we get older. Sudden or excessive sweating. Now, I know I sweat more easily than I used to, but when should we be concerned?
Sweating is normal, especially during exercise or in hot weather. But if you suddenly start sweating a lot for no apparent reason, like cold, clammy sweat, it could be a sign your heart's in trouble.
So our heart could actually be triggering that sweat response.
Exactly. When your heart's under stress, it can trigger your body's fight or flight response, and that releases hormones that cause excessive sweating.
Okay, so what should we be looking out for? What are the red flags?
If you're having sudden, unexplained sweating, especially if it's accompanied by chest discomfort, nausea, dizziness, or shortness of breath, those are warning signs you shouldn't ignore. Get medical help immediately.
It sounds like it's all about paying attention to those accompanying symptoms. All right, let's move on to number 10 on our list. Unusual or prolonged anxiety. Now, anxiety is something that many people experience, but how can we tell if it might be related to our heart, especially as we navigate life after 50 with all its ups and downs?
That's a great question. We all feel anxious sometimes, but if you're experiencing sudden, intense anxiety or panic attacks that seem to come out of nowhere, it could be your heart trying to tell you something.
Oh, wow. Really? How are our heart and anxiety connected? I wouldn't think those two would go together.
Well, think of it this way. Your heart and your nervous system are closely linked. When your heart's not working the way it should, it can set off a chain reaction in your nervous system. And that leads to anxiety-like symptoms. High blood pressure, irregular heart rhythms, poor circulation, all of that can make you feel anxious, even panicky.
So it's like a vicious cycle. Heart problems cause anxiety, and then the anxiety might actually make the heart problems worse.
Exactly. And this is especially important to pay attention to because a lot of people, especially women, experience anxiety, nausea, and fatigue as early signs of a heart attack instead of the typical chest pain.
Wow, I had no idea it could be that subtle. So if you're experiencing unusual or prolonged anxiety, especially with those other symptoms like palpitations or chest discomfort, don't just brush it off as stress. Get it checked out.
You got it. Always better to be safe than sorry.
All right, and for our final unexpected sign of heart trouble, let's talk about something a lot of us might experience as we get older: decreased tolerance for exercise. Is this always just a natural part of aging, or could it be something more? I mean, I can't run a marathon like I used to, but I'm still pretty active.
Well, it's true that our bodies change as we age, and we might not be able to do all the things we did in our 20s or 30s.
Hmm.
But a sudden and significant drop in your ability to exercise could be a sign that your heart is struggling.
Okay, so what kind of changes should we be looking for? What are the red flags?
If you're finding yourself getting winded more easily, doing things that used to be no problem, like climbing stairs or taking a brisk walk, that could be a sign that your heart's not pumping as efficiently as it should. And it's not just about being out of shape. When your heart weakens, it can't deliver oxygen-rich blood to your muscles as effectively. And that leads to fatigue, dizziness, and shortness of breath.
So it's important to listen to our bodies and not just push through it if we're feeling unusually exhausted during exercise.
Exactly. What you might think is just being out of shape could actually be something more serious, like heart failure or blocked arteries. Remember, your body is always talking to you. It's up to us to listen.
That's a great reminder. So if you notice a big decline in your stamina, don't hesitate to talk to your doctor. It's always better to be safe than sorry. This has been so insightful. We've covered 11 unexpected signs of heart trouble, and I'm sure our listeners are ready to learn more about what they can do to protect their heart health. We'll be right back after a short.
You know what? I think we should just keep talking. We've talked about all these potential warning signs, and I know our listeners are probably wondering what they can do to keep their heart strong and healthy as they age.
You're right. Let's go. Let's jump right into some practical steps everyone can take to keep their hearts happy and healthy.
It's really amazing when you think about it. We have more control over our heart health than we realize.
So true. So where should we start? What are some of the most important things we can do, especially as we get older, to protect our hearts?
Let's start with the basics. What we eat.
Makes sense. What kind of diet are we talking about? Restrictive diets? Complicated meal plans?
Not at all. It's about simple changes you can actually stick with that nourish your body and support your heart. It's like giving your heart the best fuel possible.
I like that, giving your heart good fuel. So what kind of fuel are we talking about?
Think whole, unprocessed foods. Fruits, vegetables, whole grains, lean proteins, and healthy fats.
Healthy fats, so we don't have to avoid all fat.
Not at all. In fact, healthy fats are essential, especially omega-3 fatty acids.
Omega-3s, those are the ones we find in fish, right? Salmon, things like
You've
that.
got it. Salmon, mackerel, tuna, sardines, all great sources of omega-3s. And if you're not a big fish eater, you can also get them from plant-based sources like walnuts, flax seeds, and chia seeds.
So, like adding some walnuts to my breakfast or sprinkling some chia seeds on my yogurt could actually be good for my heart.
Exactly. Little things like that can make a big difference. And don't forget those fruits and vegetables, they're packed with antioxidants and fiber, which can help lower your cholesterol and blood pressure.
So we're loading up on all the good stuff.
Yeah.
What about the things we should be limiting or avoiding?
Processed foods, sugary drinks, excessive saturated and trans fats. Those are the things that are really harmful to our hearts. They cause inflammation and contribute to that plaque buildup we want to avoid.
Got it. So swap out those sugary snacks for a piece of fruit or a handful of nuts. Makes sense. What else can we do besides our diet? I'm guessing exercise is next on the list.
You know it. Regular physical activity is essential for a healthy heart, no matter your age. But it's even more important as we get older.
True. I've always been fairly active, but I know a lot of people in our age group struggle to get started. Any advice for them?
My advice is to find something you enjoy, something you can stick with. It doesn't have to be super intense or anything. Aim for at least 30 minutes of moderate intensity exercise on most days. Could be brisk walking, swimming, dancing, gardening, anything that gets you moving and your heart pumping.
So it's not about pushing ourselves to the limit. It's about finding ways to move our bodies that we actually enjoy, right?
Exactly. And remember, being consistent is key. It's better to do a little bit regularly than to overdo it one day and then do nothing for a week.
That's good advice. Okay, I know this one can be tough, but we have to talk about it. Smoking.
It's never too late to quit, and your heart will definitely thank you for it. Smoking damages your blood vessels, raises your blood pressure, increases your risk of blood clots.
And it's not just about heart health either. It affects our whole body.
Exactly. If you smoke, talk to your doctor. There's so much help available now, from medications to counseling to support groups. You don't have to do it alone.
What about alcohol? I enjoy a glass of wine with dinner now and then. Is that okay, or should we be avoiding it completely as we get older?
Well, like most things in life, moderation is key when it comes to alcohol. A little bit is probably fine, but excessive alcohol can definitely raise your blood pressure, contribute to weight gain, and increase your risk of heart problems.
So a glass of wine here and there is probably fine, but don't overdo it. Got it. What about stress? That's a big one for a lot of people.
Oh, absolutely. Stress management is so important. Life after 50 can be a roller coaster, and it's easy to let stress take over. But the truth is, chronic stress is hard on our hearts. It releases all sorts of hormones that can raise blood pressure, increase heart rate, even damage our arteries over time.
Wow. So finding healthy ways to manage stress is essential, especially for our hearts as we age.
Absolutely. And it's not about eliminating stress completely, because that's pretty much impossible. It's about finding healthy coping mechanisms that work for you.
Like what? What are some things people can do to manage stress effectively?
Oh, there are so many options. Meditation, deep breathing exercises, yoga, spending time in nature, hobbies. All those things can help reduce stress and protect your heart. It's about finding what you enjoy and making it a regular part of your life.
So it's not just about physical health, it's about taking care of our mental and emotional well-being too.
Exactly. It's all connected. And speaking of connected, let's not forget about sleep.
Yes. Sleep becomes even more precious as we get older. At least it does for me.
I hear that. And it's not just about feeling rested. When we don't get enough sleep, our bodies produce more of the stress hormone cortisol, which, as we know, isn't good for our hearts.
So getting enough sleep is actually a way to take care of our hearts. Who knew?
Exactly. Aim for 7 to 9 hours of good quality sleep every night. Create a relaxing bedtime routine. Make sure your bedroom is dark and cool. Avoid caffeine and alcohol before bed. All those things can help.
Great tips. So we've talked about diet, exercise, smoking, alcohol, stress management, and sleep. Anything else we should keep in mind when it comes to protecting our hearts as we navigate this chapter of life?
I think one of the most important things is to be proactive. Don't wait until you have symptoms to see a doctor. Get regular checkups, blood pressure, cholesterol, heart screenings, those sorts of things.
Those routine checkups can be so important, right?
They really can. Early detection is key when it comes to heart health. And having regular checkups means your doctor has a better chance of catching things early on when they're often easier to treat. And don't be afraid to ask questions. Be an active participant in your healthcare. You're your own best advocate.
That's great advice. This has been so helpful. I'm feeling much more informed. So we've covered these 11 unexpected signs of heart trouble and all these practical steps we can take to keep our hearts strong and healthy. What's one final thought you want to leave our listeners with today?
It's easy to get caught up in worrying about heart disease, but I want people to feel empowered, not scared. Knowledge is power, as they say. By understanding the risks and being proactive, we can all live longer, healthier, more fulfilling lives.
That's a great way to look at it.
Yeah.
Knowledge is power, and taking control of our health is one of the most empowering things we can do, especially as we age, wouldn't you say?
Absolutely. It's about moving from being afraid to actually taking action,
Right. So we've talked about those unexpected signs and some practical steps to keep our hearts healthy. Is there anything else we should remember as we're navigating heart health after 50?
Well, I think it's important to remember that you're not alone in this. There are so many resources out there to help. Your doctor, of course, and online communities, support groups. Don't be afraid to reach out. Get some guidance. Talk to your friends and family. Share your experiences.
Yeah, support each other. That's so important, isn't it?
Yeah.
We're all in this together. Sharing can make a big difference. Like having a whole cheering section for your health journey.
I love that.
Well, I think we've given our listeners a lot to think about today. Any final pearls of wisdom before we wrap up?
It's easy to get overwhelmed by all the things we should be doing for our health, right?
Absolutely.
But honestly, focus on progress, not perfection. Celebrate those small victories. Every step you take towards a healthier lifestyle, that's a gift to yourself and the people you love.
That's so true. It's all about making those choices that support our hearts, both physically and emotionally. So to all our amazing listeners out there, we encourage you to tune into your bodies, be proactive about your heart health, and never be afraid to ask for help. You're never too old to make changes that benefit your heart and your well-being. Until next time, stay curious, stay informed, and keep those hearts happy and healthy.